but I'm almost on my way to pick up my... Scar tissue restriction from any abdominal scar can lead to bladder issues like urinary retention, incomplete bladder emptying, constipation issues, pelvic pain, abdominal pain, and painful intercourse. So yes, you should do it, and even 3 years later. Yes, you can still do it. I've worked with women in their 60s and 70s who benefit from C-section or abdominal wall scar massage. So yes, you can do it. The recommendations for this are 1 year post-vaginal birth and 18 months post-cesarean section. People do what's right for their families or things happen, but those are the recommendations. I would actually recommend working with a pelvic floor physical therapist in person just to prepare for going into surgery, for strengthening and then post-op recovery. You can also do my postpartum strengthening series just to start strengthening your pelvic floor before the hysterectomy. False, we can totally help with hemorrhoids, but I don't blame your midwife. They just may not know that we can do a ton of butt stuff. I'm going to link to a blog post on hemorrhoids here, and yes, pelvic PT can totally help with that. So common. Myself also peed when I was pregnant, when I was coughing. I actually created a pregnancy pelvic floor strengthening program specifically for this, and also tried to Kegel before you cough to see if that helps. So when you go through menopause, your estrogen levels decrease, which typically causes vaginal dryness and painful intercourse. So I have a whole blog post about some things that can help for menopause, but use a lubricant, daily moisturizer, dilators. I would insert a tampon while you're running to help support your bladder. I'm going to link to my postpartum strengthening series, which is designed to help you start running without leaking. And I would pull back your runs a little bit, strengthen your pelvic floor, then start increasing your runs again. First of all, congratulations. You can schedule with one now. You can meet with them in the first trimester. I usually don't start until my patients are second trimester at the very beginning so that we can do an internal assessment, and then I'll link to my pregnancy exercises here. You would start by seeing a gastroenterologist, but I would also check in with a pelvic floor physical therapist to see if it's a pelvic floor related issue, but a GI doctor can also refer you to them, and I'll link to a pooping post here. Because I love helping people with something they didn't know where to get help for. I love that our treatments are one-on-one, so I don't have to see like a bunch of patients at one time. And I love understanding more about my own body as a woman. A key for me has been to shorten the amount of time I'm working out. So instead of going to hour-long workout classes, I really just do a 10-minute to a 30-minute workout 2 to 3 times a week. And that's just been key for me. I also have a Peloton and I do my V-Hive workout. These things are not mutually exclusive. You can strengthen and still use your toys, so no need to stop.